Hi, good morning. This is Kavita Kundra, and we are here covering Ignou Mscdfsm Physiology because biochemistry is over, and we are having this chapter covered now, cardiovascular system. So, cardiac output, it is the output of the heart per minute. Cardiac function is best expressed as quantitative term as amount of blood pumped by each ventricle per minute. So, we already know that we are having a four-chambered heart, two ventricles, two auricles. The amount of blood pumped by each ventricle per minute and the amount of blood pumped by either ventricle during every beat is about 70 ml at rest, and heart beats about 70 times per beat at rest. तो पर बीट जो है कितनी बार करता है हार्ट बीट 70 times. Okay, the cardiac output is expressed as under stroke volume multiply heart rate. So stroke volume is 70 ml, we have already done that, into 70 beats per minute. So it comes out to be 7 sevens of 49, so 4900 ml per minute, that is approximate 5 liter per minute. So cardiac output per unit body surface area is relatively constant from one individual to another, and it is called cardiac index. Cardiac index comes out to be cardiac output upon body surface area. So surface area is, how will you take out the surface area now? 5 liter per minute upon 1.7 meter square is equal to 3 minute upon meter square. So cardiac cycle is a sequence of events that occurs when the heart beats. There are two phases of cardiac cycle. One is diastole, second one is systole. Diastole is a stage when the ventricles are relaxed, and systole is when ventricles are contracting. So diastole phases, during diastole phase, atria and ventricles are relaxed and atrioventricular valves are open. The blood is going from one compartment to another. The deoxygenated blood flows into the right atrium. An open atrioventricular valve allow the blood to pass through the ventricles. SA nodes contract, triggering atria to contract, and the right atrium empty all the content into the right ventricle, and there is a tricuspid valve. We have already learned that. So tricuspid valve prevent the blood from flowing back to the right atrium. So blood once goes down to the compartment, it's a required compartment, it never goes back. Okay, so you have a very nice system in your body. So what is systole phase? Systole phase, the ventricles are contracting. The right ventricle receives impulse from Purkinje fiber and contracts, and the atrioventricle closes. When these contracts, the valves close down, then the blood is not exchanging into the compartment. It's not going anywhere. So deoxygenated blood is pumped into the pulmonary artery. The pulmonary valve prevent blood from flowing back. The same thing, valve will do the same thing because it should not mix the oxygenated and deoxygenated blood. So the pulmonary artery carried blood to the lungs, and the blood picks up oxygen and return to the left atrium. In left heart, during diastole phase, semilunar valve closes and atrioventricular valves open. Blood from pulmonary veins fill the left atrium. Now SA node contracts. Atria also contract left atrium, empty their content into left atrium, and mitral valve prevent oxygenated blood from flowing back. During systole phase, the atrioventricular valve close and semilunar valve open. The left ventricle receives impulse from Purkinje fibers and contract. Oxygenated blood is pumped into aorta, and aortic wall prevent blood from flowing back. So valve had that mechanism that it prevents back flowing of the blood. Once it comes in, it never goes back. So aorta branches out to provide blood to the all parts of the body, and deoxygenated blood is returned to the heart via vena cava. Got it? And one contraction, systole, followed by diastole. So one contraction, then relaxation. Contraction and relaxation. Contraction means systole and relaxation means diastole. Systole, diastole. Contraction, relaxation. Let's take an example. The heart rate is 75 per minute. If 75 beat take 1 minute, then 1 beat will take how many minutes? We have done it already from the very starting in the maths class. If you remember, from 3rd and 4th we say that how many apples you have, right? So if 1 apple costs you this much, 10 apples costing you how much? So that kind of question. So same thing. If 75 beats take 1 minute, and then 1 beat will take 1 upon 75 minutes is equal to 1 into 60 seconds upon 75 is equal to 0.8 seconds. Her systole lasts, heart systole lasts for 0.3 seconds and ventricular diastole lasts for 0.5 seconds. When the heart rate increases, the duration of cardiac cycle also increases. In such situation, reduction in duration of diastole is greater than that of systole. So relaxation is reduced. So heart sound. Heart has 2 sounds, lub, dub. Lub, dub. Lub is closing. When the walls are closing, there is a sound lub, while dub is closing of pulmonary and aortic valve. There is a gap between 2 thumbs and it is called resting period. It is called diastole period. Resting means diastole. During this period, heart receives its nutrition and maximum supply during this period. Stethoscope is an instrument that used to listen heartbeat, and stethoscope has a bell, we all know, and conducting tube and earpiece. The bell placed on chest to hear the heartbeats. Blood pressure. Blood pressure refers to arterial blood volume, and it is the lateral pressure exerted by the column of blood on the wall of arteries. It fluctuates, means decreases, increases, fluctuate during the cardiac cycle and during ventricle systole. Arterial blood pressure is higher than during diastoles. That means contraction has high blood pressure than relaxation. The normal systolic blood pressure is 100 to 400 mmHg, and that of diastolic pressure is 60 to 90 mmHg. Blood pressure is commonly measured as using a mercury manometer, and it is expressed in milliliter of mercury. The blood pressure is measured by spigometer, and it contains inelastic cuff. That contains rubber bags. One tube connected to the bag of manometer, other tube connected to the bulb fitted with a valve that is used for deflating the rubber bag. You have seen in the doctors, they wrap up your arm and then they press that bulb. Okay. During deflation, the pressure at which sound just appear is called systolic pressure, and the pressure at which it disappears is called diastolic pressure. Then they calculate how much your blood pressure is. When 1/3 of blood pressure is added to diastolic pressure, then we get a value. Multiplying the diastolic pressure determined by 2. Adding the systolic pressure, then dividing the sum by 3, estimate systolic pressure is 110 mmHg and diastolic pressure is 80 mmHg. Mean blood pressure, 80 plus 1 upon 3 in bracket 1110 minus 80 mmHg, or 80 multiplied by 2 plus 110 upon 3 mmHg is equal to 90 mmHg. Mean blood pressure, it is a major determinant of blood flow through the tissue. How to record blood pressures? Blood pressure is recorded as systolic pressure and diastolic pressure. It is written as 120 upon 80 mmHg. It is verbally expressed as 120 over 80. The difference between systolic and diastolic pressure is known as pulse pressure, and the normal pulse pressure is approximate 120 minus 80 is equal to 40 mmHg. Factors affecting blood pressure. From Ohm law, it is easy to deduce that blood pressure would roughly equal to the product of cardiac output and peripheral resistance. That means BP is equal to COPR. Factors affecting the cardiac output. How will you increase the cardiac output? Increase in blood volume increases the venous return and lead to increased stroke volume. The increase in blood volume may be because of water retention when your body retained water due to sodium retention, or due to the increased aldosterone, or during exercise also it can increase. The cardiac output increases due to the increase in both stroke and heart rate. Systolic pressure increases during exercise. An increase in heart rate does not always alter the blood pressure, as if stroke volume decreases, the cardiac output doesn't change. Emotional excitement also increases the systolic as well as diastolic pressure, cause of increased sympathetic adrenal activity. So how will justify decreased cardiac output? What are the factors? What are the different reasons? Change of posture. When a person stands from sitting position, there is a fall in systolic pressure as pooling of venous blood in lower limbs due to gravity. And it leads to decreased venous return that further decreases the stroke volume and cardiac output, causing a fall in systolic pressure within 15 seconds. Baroreceptor reflexes bring out cardio acceleration and vasorestrictions. As a result of blood pressure returns to the normal. Hypovolemia or reduction in blood volume. It decreases the cardiac output that causes fall in systematic blood pressure produced by hemorrhage, and baroreceptor reflexes corrects the fall in blood pressure due to moderate hemorrhage. If a loss of blood is then 10% of total volume, the mechanism succeed in stabilizing the blood pressure at the level below normal pressure. But if loss is more than 30% of the mechanism fail to irreversible and fatal in blood pressure. Cardiac compression. Rapid accumulation of fluid in pericardial sac decreases the ventricular distenability, leading to the decrease in cardiac output, leading to decrease in cardiac activity. That means it will not be that much. So myocardial ischemia, an infection is insufficient blood flow or death of heart cells. So infection is mainly a death of heart cell. It reduces myocardial contractile force and thereby reduces the cardiac output. Trauma, any injury that causes intense pain reduces the blood pressure. So now you understand what exactly the heart and blood pressure is, and what are the factors for decrease and increase cardiac output.